Hello, everyone. My name is Olivia Giles. I am the Louisiana Nurses Political Action Committee Secretary and Treasurer. LANPAC is conducting interviews with candidates for our state legislature. We want to learn more about where the candidates stand on issues important to nurses and the health and welfare of our citizens. LANPAC solicited input from the nurses in our state, and then the LANPAC board finalized questions from the top issues submitted. These questions were sent to our candidates prior to their interview. I am delighted to welcome Senator Barry Ivey, who is
Well,
running.
state representative, trying to be senator. So
Oh, sorry.
you may have been prophesying a little bit. We'll see.
So, State Representative Barry Ivey, who is running for District 6. Representative Ivey, I would like to turn it over to you for brief opening remarks prior to us moving forward with the questions.
All right. Thank you very much. So again, Barry Ivey, I've served in the House of Representatives for District 65 for the past 11 years, and I am term limited and still have a passion to serve, and am pursuing the opportunity to serve Senate District 6, and excited, about pursuing that. And I've been married for 25 years, the love of my life. We have 4 children together, boy, girl, and their ages are 24, 22, 19, and 16. And my oldest daughter and her husband just gave us our first grandchild about 8 weeks ago. So I'm in the pawpaw club and loving every minute of it. And so our children and grandchildren are really what drives me and what motivates me in trying to help transform Louisiana into a state that that they want to stay in. Our kids are leaving because I think they don't have hope, and they just don't believe there's real opportunity here. And so we work very hard to focus on the areas and issues that will hopefully help transform that failed status quo that we have in Louisiana. And so I don't know how much time I got left, but that's the intro.
Thank you for those remarks. Now I will move on to our first question, which is about healthcare disparities. Prior to COVID-19, we recognized healthcare services are not accessible on an equitable basis nationally and in Louisiana. Healthcare is only 20% of what accounts for one's health status, and the social determinants of health are the non-medical factors that influence health outcomes. What strategies do you have to assist with reducing the social determinants of health impact on the citizens of Louisiana?
Well, I support access to care, and obviously, I know the question is really, away from the directly health care, but just access to care, itself is such a huge component. And I know it's brought up later, so I won't go with that now. We have, there's food insecurity, access to quality food nowadays. Anything healthy is costs a premium. And so I've actually had ideas and worked, trying to get some study resolutions in the past. And while unfortunately a lot of SNAP benefits and things like that are really directed at the federal level, one of the ideas I've had is, combining health, care outcomes that could be dramatically influenced by nutrition and people who happen to be on SNAP. A lot of the times they just don't have access to the better quality food, or maybe they don't have the education and things like that to be able to cook and prepare and things like that. And so combining, creating a new program where more resource, more funding could be available for people who choose to work with their physician, work with a nutritionist, get some education and provide the, more funding, but be more restricted in, the types of foods that can be purchased through that. I believe can make the lifelong difference besides having a dramatic decrease on healthcare costs, but it can just, increase the quality of life of that individual or family dramatically. And so I think we really need to focus on some of the roots of the problems. And again, poverty and the lack of healthy food choices, for those people. And sometimes it may not even be funding. There's no stores in their area Sometimes we've learned about food deserts and things like that. So I support efforts to certainly improve those fundamental issues that we're facing.
Okay, question two. Question two is about faculty shortage in education. How would you advocate for federal and state funding to support recruitment and retention of nursing faculty to reduce the nursing shortage?
Okay. Well, first, we should make sure that all federal funding that is available is being drawn down through grant programs. So we need to make sure that that is being taken advantage of. In addition to that, and we do this in certain other medical professions where it's really geared on the practicing in rural areas, of a physician. But I believe that we could expand, since we have such a difficult task of trying to recruit and retain some of these professionals, just from the teaching side of the profession, that we could entertain an incentive program, tax incentive, tax credits, things like that, that would help offset what we can, be assured to be a lower, not as competitive salary compared to someone working in the private sector. And so it's through those incentives and things like that that we might be able to help attract and retain, more professionals to teach.
Okay, question three is about safety and violence. It is a two-part question. I will begin with the first part of that two-part question. Gun violence continues to roar through our communities. Schools, houses of worship, shopping malls, grocery stores, outdoor gatherings, and etc. What factors do you see as critical to bringing an end to these senseless acts? And do you have a strategy to address this problem?
All right, first part. So, gun violence these are people who are making bad decisions with a firearm. In most cases, it's illegal firearm possession, and these are just criminals, doing bad things. Besides the folks that are taking action based on, drug abuse or mental health issues. So, I think drugs in our culture is created such a tremendous ripple effect. So there's a tremendous demand for illegal narcotics, the entire spectrum. And with that, you have people who, deal in drugs. And when you get the cartels and the gangs and everyone else who's really in that market, these are all people who their entire business model requires violence, and of course, firearms are a critical component to that. It's why illegal purchase or illegal firearms, like stolen firearms, are in high demand, and they fetch a premium on the black market. And so I believe that, we have to really focus on changing our culture away from, drugs, and which will make a tremendous impact, I believe, in curbing the, gun violence, particularly that, that's associated with the drug, culture. And then the second part, we need more resources and solutions that are geared towards, solving our mental health crisis in our state. Too often people are just, they're arrested and then released because there's nothing a jail can do to serve those people, and these are people with very serious problems. And so I don't have the solution for that. I believe that's going to take a community of stakeholders who have a more intimate knowledge of the problem to help innovate solutions to where we can provide, the most value for the tax dollar that also has the most benefit to the people who really need those services.
Okay, so now I will read part two of that question. Rapid fentanyl test strips can be used to determine if drugs have been mixed or cut with fentanyl. With important information about fentanyl, healthcare providers can take steps to reduce the community risk of overdose. How would you support legislation to make rapid fentanyl test strips more readily available?
So I have supported the legislation to decriminalize possession of the fentanyl test strips, as you know, it was considered originally paraphernalia. And so one option would be for the state to make a large procurement, having a bulk purchase, hopefully, make the cost per strip, much more, affordable. And then, we could create a distribution network from different stakeholders from our hospitals and other medical and healthcare facilities to also other NGOs that actually work, out there on the street, working with these the people who are unfortunately they're caught up in the drug culture. And so, but what we don't want is our kids dying because they think and they're smoking a little bit of marijuana, and all of a sudden it's because it's laced with fentanyl, they're dead. And so it's a crisis, and I think it requires a different perspective. We can't just say, oh well, it's their fault. They were, people make bad decisions. That's true. People making a bad decision to maybe smoke marijuana isn't the same thing as someone who knows they're wanting to get high on the more hard drugs. And unfortunately, the cartels and everyone else, they're lacing everything with fentanyl because of the high, and to hopefully get them more addicted. So.
Okay, so our next question is about access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their education, licensure, and training?
Absolutely. I have been consistently supportive of expanding access to care across the board where it just makes sense. We have boards that are responsible for licensure and oversight of their members, and I believe that the practitioners should be able to practice to the full extent that their education and training and experience allow, under the oversight of their own boards. I authored HB 495 in the 2021 regular session, which would actually provide for full practice authority for advanced practice registered nurses. And we actually were able to get that bill all the way from the House floor, Senate committee to the Senate floor, where the Senate president decided not to let it go up for a vote. So we got it all the way to third base. And hopefully, as a state senator, I will help get that ball all the way, get it around all the bases and get home, and again, make a big impact, not only for the profession, but certainly for the people who are in need of access to care and access to these professionals.
Thank you. We will transition to our two general questions.
Okay.
What are your legislative priorities?
Okay. So my legislative approach is just as a legislator, is how I look at everything. It's people, principles, policy. That's my approach. My philosophy is do the right thing for the right reasons. What I try to focus on are things that have the policies that have a positive impact on transforming, opportunity for people in the state of Louisiana. And so program things that create opportunity for upward mobility, I believe that, require investments, and the state should be, in the business of investing in people as a means to create that opportunity. And I believe it has the greatest return on investment, and also has, the greatest ability to really transform our state. Too often we throw money at everything else, even in the business community, we throw hundreds of millions of dollars at programs that the data just shows as a poor ROI. But if we would invest more in, training and education and things like that, well, now we have a more qualified, more skilled labor force that will be the incentive for businesses to come here, and everyone can thrive together. So those are the types of things. But I believe we need to focus on strategic investments and innovative policies in education, healthcare infrastructure, and technology is something we really have to invest in. It has the greatest ROI, in my opinion, and it really helps us make more informed decisions.
Last question. Why should the Louisiana nursing community support you as the best candidate for this legislative seat?
Okay, so I've served in the House of Representatives for 11 years, and I can say that there are no legislators like me. My work ethic, my skill sets that I've developed have enabled me to become very efficient in evaluating policy and how that policy affects people. And for the past 11 years, I have acted upon my personal commitment to completely disregard politics in my decision-making process. And my approach to fulfilling my role as a legislator has always been to focus on people, principles, and policy. And again, my philosophy is just to do the right thing for the right reasons and don't worry about anything else. And so I will continue to be an advocate for the people in the Senate and fight the fights that unfortunately too few legislators are willing to fight, because the politics comes, and so it doesn't matter if it's the governor, if it's a industry, if they group, you know the people need advocates for them, and unfortunately on too many issues there's just no one there. And so
Thank you, Representative Ivey. I would like to give you 2 minutes at this time to give your closing remarks.
okay, so I hate politics, and if you've been in Louisiana long enough, there's a million reasons to hate Louisiana politics. Louisiana politics is a primary reason why our state continues to fail our children and grandchildren. We go back generations, and this is the case. And so our kids' future has been robbed because of politics. Politics has never solved a single problem, as far as I can tell. And so we need people who are innovators, who are thinkers, who are capable of working on complicated problems with diverse groups of people to come up with innovative solutions that are actually capable of transforming our state for our children and grandchildren. And so this is my focus. This is what drives me, what motivates me, and it makes me an outlier because we give too much lip service to all the to 1% of the policy gets 98% of the attention, and then everything seems to just be whatever special interest wants, and it's just the way it is. So I'd appreciate y'all support. Certainly y'all have my deep appreciation for the work y'all do throughout our communities, and we just need more trained professionals, more healthcare workers, particularly in the nurse profession. And I know y'all are doing your best to be a part of the solution, and appreciate that.
Thank you for taking the time out of your busy schedule to share your responses with us today, and good luck with your campaign.
Thank you
And
very much.
I want to wish you a great rest of your day.
All right.
Thank
Thank
you
you.
so
Appreciate it. You have a
much.
great day too. All right. Bye-bye.
Bye.